Well, May is Mental Health Awareness Month, and every Thursday we're reaching out to mental health experts to discuss a range of topics. And today we're hearing from a postpartum therapist, Robin Alagona Cutler, and she helps parents through fertility issues and also postpartum depression. And she joins us live now. Thank you, Robin, for joining us. So what are some of the signs of postpartum depression?
Thanks for having me. Yeah, some of the signs for postpartum depression, it's interesting because when we think of depression, we think of sadness and crying, and certainly that can be part of postpartum depression as well. But even more than that, most moms are experiencing things like anger and irritability. And so that can sometimes surprise people, but that is definitely one of the most common things that people come in with. So really paying attention to that, obviously the crying and sadness, as well as any appetite or sleep disturbances, increased feelings of guilt and or shame, hopelessness, and a lack of interest in things that you would normally be interested in.
And I'm just curious, when we talk about postpartum depression, like how postpartum are we talking? How much longer after someone's had a baby? Does this go 2 years, 3 years, 4 years?
Yeah. Great question. So baby blues, which is something that I think a lot of people have heard of, that's that like really initial first period of time. So any time from 0 to about 3 weeks postpartum is kind of when the baby blues can show up. And then any time really after that, until 1 year or even longer, is when postpartum depression can show up. So you could, feel okay, and then it could pop up later. And I think that's also really important for people to be aware of.
So there are a lot of visits before a woman has a baby, almost like it's weekly, but there's only one after for postpartum analysis. Is that evolving to bring more attention to parents following birth?
I think depending on where you have your baby and who your provider is, you may have the opportunity to have more than one postpartum visit, but that's still pretty much the standard practice. And it really, unfortunately, is not, really giving people the opportunity to have that like face-to-face experience with their provider where they can really be assessed for how they're doing.
What about people struggling to have a baby? What tips do you have for parents, especially if they're seeing everyone around them have babies?
Yeah, get support. Fertility struggles are unfortunately quite common, and it is a risk factor for developing a perinatal mood or anxiety disorder. So I would say get support, and seek that in your community from a therapist, other resources. I want to let people know about Postpartum Support International, which has a ton of really helpful resources for all of these things.
All right.